Okay, I want to welcome everyone today on this snowy day in Michiana. My name is Lisa Kelly, and I'm Executive Director of Mental Health Awareness of Michiana. We're delighted to welcome you today to Suicide Among Black Youth, Understanding Context, Assessment, and Treatment. Um, this is a hard topic, and the number of registrants, we had over 160 people register for today. So we know this topic is really important to the community. And I'm just really grateful, Dr. Nicoletti, that you're presenting today. So we're delighted to welcome all of our attendees as well as you to being here today with us. So I'm going to read your bio, and then I'm going to turn it over to you.
Great.
So Dr. Nicoletti is a licensed clinical psychologist and assistant clinical professor at the University of Notre Dame Psychology Department. Her interests are in the area of clinical strengths-based trauma-informed services to Black children and families in urban low-income settings. Dr. Nicoletti provides clinical training and supervision to Notre Dame doctoral students in the delivery of empirically supported assessments and interventions for children, adolescents, and families. Dr. Nicoletti is also a part of the Suicide Prevention Initiative, Research, Intervention, and Training, or SPIRIT, where she offers clinical services, training, and community engagement efforts addressing suicidality among children and adolescents. So Dr. Nicoletti, we're honored that you're here today with us, and I'm going to turn it over to you.
Great. Thank you, Lisa and MHAM, for that warm and thoughtful introduction. And thank you, everyone that's on Zoom, for joining us today in the conversation about Black youth, understanding suicide among Black youth, understanding context, assessment, prevention, and intervention. If you can't tell by that title, we have a lot to get through today, so I'm just going to jump in and say that I'm really thankful to be here with you. Lisa spoke a little bit to some of my experiences, but it's really an honor to be talking with people that are on the front lines. I know that this webinar was open to a wide range of audience, so we have providers, we have maybe mental health and health providers, teachers, people who provide all kinds of different care for the community. So I'm excited and honored to be with you all today. When I went to Chicago to get my training in psychology, focusing on Black kids and families, I had the opportunity to walk with families through trauma, suffering, medical illness, and I actually specialized in that time in childhood stress, trauma, and resilience among Black youth. And during my final year of training at the University of Chicago, I was in their pediatric hospital, and I was almost kind of like one of the first responders to a child being admitted for a trauma-related reason. So oftentimes children and teens were being admitted for gunshot wounds or community violence-related complications. But over time, really quickly within my training, within that year, something shifted. And if I wasn't seeing a young Black pediatric patient for a community violence related concern, a gunshot wound, or some kind of fight that they got into at school or something like that, I saw them for what they called intentional ingestion of pills or overdosing, or an attempt to die by suicide, or significant harm to themselves. So I was essentially day in and day out seeing young Black kids as young as, I think the youngest client I saw, or the patient I saw, was 6, all the way up to 24, who were being admitted because they were either hurt by another person in their community violence, or because they were unfortunately engaging in harm with themselves, which was really different than my prior training experiences. Prior to that, a lot of the conversation that I had been taught and trained in was Black youth engage in a lot of unhelpful coping, just the way that plenty of other youth do, right? But they don't engage in suicide. That was something that I remember being very explicitly taught to me, that by and large, Black kids don't hurt themselves for a lot of different reasons, right? And so you can imagine that experience was really shocking for me to think about, like, okay, so what does it look like now to not only help kids through their trauma, but to also help kids through suicide and thoughts of death or wanting to harm themselves. So I'm excited to talk more about that with you today and kind of how it came from there to where we are now. So as we jump into our conversation about suicide, I want to acknowledge that with a group this large, suicide and suffering impacts us all, right? So I want to just take a moment to acknowledge that, to be mindful of that, whether you are a provider or a teacher or a coach or a friend, it impacts us all. So when we're entering conversations like this, even when I'm conducting training with my students, I like to sort of start off by just like taking a moment, by truly just taking a deep breath and reminding myself and each other that we're safe in this space. And that there are resources available at the end of this conversation if you need that. So topics of discussion for today. First, I'm going to provide just general background on suicide among Black youth. And then we're going to jump into the contextualized experiences of Black youth at risk for suicide, particularly from a specific framework, a socio-ecological framework that highlights specific risk and protective factors that are unique to Black kids. Then I'm going to identify some screening and assessment tools for suicidal behaviors in youth. Now, for the sake of time, I won't necessarily spend a lot of time going through each of the screening and assessment tools that we have, but I have linked all of them. So once you get this PowerPoint, you'll be able to click on each of the different screening tools, and it'll either take you to the actual screening itself or it'll take you to a training. I think there are a few of them that offer a free training on how to administer the screening. It'll highlight who the screening is appropriate for and who's appropriate for giving the screening, right? A lot of these screening and assessment measures are for mental health providers or individuals who are working directly with kids and families. After we talk about some screening and assessment tools, we'll talk a bit about prevention and intervention strategies. I'll, give an example of something that I'm working on, and then I want to make sure that we leave some time for Q&A to ask some questions and to engage in some discussion. And then I believe at the very, very end, there is a survey that needs to be filled out for MHAM. So I want to make sure we give them time to address that as well. So when we talk about suicide, it's important for us to use the appropriate language. The language around suicide has changed over the past 2 decades. Unfortunately, most people aren't aware of these changes in how we talk about suicide. We know that words have the power to heal, but they also have the power to cause harm. So whether unintentional or not, words, the kind of language we use can bring out stigma or attitudes about how we feel about suicide. So the biggest change in language relates to how we refer to suicide as a cause of death. In the past, terms as like committed suicide or completed suicide have been widely used. And the words commit or committed may imply that the act of suicide is criminal, or that it's some sort of like moral sin, or that it's the person's fault. We want to move away from that. One way to consider it, like a litmus test, is talking about suicide is to substitute the word for cancer. So if you think about it, you would never say they committed cancer, right? Or they had a successful cancer. We would simply say they died of cancer, or it was a cancer death. Same thing goes for suicide. We should be saying died by suicide, or it was a suicidal death. Other important terms we want to talk or think through as we engage in our conversation today: suicidal ideation. That's thinking about, considering, or planning suicide. That ranges from fleeting thoughts that, pass in and out, or persistent kind of chronic obsessions. And we know that even suicidal ideation itself looks different in different demographics and different age groups. Suicide attempt, that's a non-fatal, so non-dying, self-directed, self-imposed, potentially injurious behavior with intent to die as a result of the behavior. And suicide attempt might not result in injury. And then we have suicide itself, death caused by self-direct injurious behavior with the intent to die as a result of the behavior. And then at the bottom here, you'll see a few different terms that are sometimes used together, but sometimes broken up depending on literature and who you're talking to. But self-injury, self-harm, non-suicidal self-injury, or what people call an SSI, is deliberately causing harm to oneself, sometimes with or without suicidal ideation. So let's jump into first just discussing suicide among Black youth and the data. Historically, suicide rates have been lower among Black youth compared to their peers of other races and ethnicities. So this is in line with a lot of my training prior to the past few years, that we didn't have a concern, and the data didn't show any concern at that point. That's significantly changed. In December of 2019, the Congressional Black Caucus Emergency Task Force on Black Youth Suicide and Mental Health released a big report titled Ring the Alarm, the Crisis of Black Youth Suicide in America. And the report really revealed a rapid increase in suicide rates among Black youth. And it also showed the very limited knowledge we had on the topic area, on prevention strategies, on intervention strategies to address the problem. The report identified lots of different gaps in the literature, and that report sort of was the maybe like the catalyst to a lot of new research that's coming out right now. So a few things to note just about the data in general. One, suicide is the second leading cause of death in Black youth 10 to 14 years of age. It's the third leading cause of death in Black youth 15 to 19, and that's only because assault or homicidal assault is now the second leading cause of death for Black youth ages 15 to 19. And then, as I've noted, the suicide rate for Black youth is increasing faster than any other racial ethnic group within the US. And something that I'm particularly concerned and interested in addressing is how recent studies show that Black youth under 12 are twice as likely to die by suicide than white youth under 12. So Michael Lindsay, he's a faculty member at New York University. He's a researcher, and his colleagues, they worked together and they were able to look at a nationally representative sample, school-based sample of over almost 200,000 high school students. And they looked at those students between 1991 and 2017. And some important findings they found were that one, Black students had the highest prevalence of suicide attempts. Black male students had the lowest prevalence of suicidal ideation. So that's where the interesting part, comes in, is Black male students don't report having thoughts of suicide, but they do have suicidal attempts, right? So that speaks to, like, how are we measuring thoughts of suicide based on age, race, demographic, those sorts of things. And then also Black adolescent boys experience increased rates of injury resulting from suicidal attempts. So that specifically is speaking to the use of firearms being one of the number one ways that Black adolescent boys in particular engage in a suicidal attempt, and that lethal means. Here's just another way of looking at the data that I just discussed, and you'll see the changes between 1991 and 2017. But in 2017, being that dramatic difference in the increase in suicide attempts for Black teenagers in particular. Earlier, I spoke to the concern around those Black children who are under the age of 12. So one study shows that Black children ages 5 to 12 are twice as likely to die by suicide than their white peers. And here's just another way of looking at that data, and something for us to consider. So let's pull some data closer to home, right? Those are more national kind of ways of understanding suicide among Black youth. But let's pull some information about Indiana in particular. So this is the Indiana Department of Health. Every year they provide, I forget the full name, but the Indiana Youth Institute provides some general data. And I think it doesn't necessarily capture all of Indiana, but they try their best to capture some of it. And so I wanted to show a little bit of that. For one example is that 27.7% of high school students in 2021 reported to seriously consider attempting suicide. Compared to prior years, it was under 20%. So that's a significant 10% almost increase over time. And of those high school students, 65% of the students who seriously considered suicide identified as gay, lesbian, or bisexual. And then when we look at the top 5 causes of death for our kids in Indiana, suicide is the second leading cause of death for ages 10 to 17, and the third for ages 18 to 19. But again, that's only because assault took that higher spot for the second leading cause of death. So I bring this up to say that suicide among Black youth is a concern not only nationally, but also within our own state. So here we get into what I would talk about as contextualized experiences. So understanding suicide requires a multi-level approach and examination of the context. So it's not enough to say that this is happening and we should address it in a general way, right? There are unique and specific experiences among Black youth and children and adolescents, separating those out, that we have to intervene and address those specifically. And we do this by taking a closer look at the contextualized experiences of Black youth using the application of different models. One model that we're going to talk about today is the socio-ecological model. So we can jump into that right now. The model provides a comprehensive framework to understanding risk and protective factors. And to understand the context, we need to look at varying levels. So you'll see the model here that I have has 4 different levels. We have the societal level, we have the community level, interpersonal relationship level, and then we have the individual level. So societal meaning larger scale issues such as social and cultural norms or policies, guiding rules or laws. Community refers to a specific region or neighborhood. This might include schools, workplaces, healthcare settings, the places that many of you are occupying. Relational factors include direct social interactions, so social support, peers, families, close friends, kinship connections, those people that aren't blood related to me but are my cousin or my auntie. That's the relational factor. And then finally, we have individual factors. These are person-level characteristics. It might include demographics such as age, race, gender, history of health condition. So this multi-level framework that we have here provides us with a nuanced way of seeing how each level interacts with each other. So it's hard to demonstrate, but what we want to see is how does the societal factors impact the relational factors, or how does the community factors impact the individual factors? So we'll go through that together a little bit today. But this is going to be sort of like the guiding framework for how we talk about the risk and protective factors among Black youth at risk for suicide. So when I'm talking about models, I can't help but share other adapted models that have come across the literature over the past few years that I think do an even better job of sort of capturing or providing representation specifically for Black youth. So you'll see this model, this really colorful one by Stern and colleagues from 2021. And the minute I saw this, I just thought, like, this is the kind of stuff I was looking for in my training. Very specific, unique ways to understanding Black childhood development and how different parts of the system impacts their thriving or otherwise, right? Or otherwise meaning, adverse childhood experiences or stress. I also have here the interpersonal psychological theory of suicide through an intersectional framework. So intersectional, speaking to some work by another researcher, Kimberly Crenshaw, who basically says that there's a lot of different parts of ourselves or identities that intersect in a way that either increase our access to resources or opportunities, or do otherwise. They decrease our opportunity or prevent us from thriving. And so these are just 2 other models that I like to sort of use and think through as we have the conversation about risk and protective factors. So let's jump into the suicide risk factors impacting Black youth using the socio-ecological framework that I just went over a minute ago. And that was that blue one here. That's what we'll be using for the rest of our talk today. So here you'll see I've identified a diagram with an overview of the most well-known risk factors for Black youth. And many identified factors for suicide work in concert, like work together to contribute to risk, right? So what I want to highlight is it's not just poverty. It's not just, what do we have for community? Police violence. It's not just social isolation alone. It could be, but oftentimes, and the way that we understand socio-ecological frameworks is that all these different pieces are interacting together that increase someone's risk for suicide. So I'm going to go through each of these individual tiers, so societal, community, relationship, individual. I'm going to go through them one by one. I'm going to start with the societal level. And I've listed another wonderful model. And again, when you have this PDF for those that are more research interested and looking at data and theoretical perspectives, when you have this, you'll be able to click on some links and click on this picture even, which will take you to a study that talks more about like how this diagram was developed and all the model was developed. What we want to highlight here are the different societal level risk factors. The first one being structural or institutional racism. So institutional racism exists both in the present and has ramifications from a historical perspective. And what I mean by that is like there are ways in which in this moment institutional racism is impacting all of us, but it's also the insidious nature of racism is the way in which the historical nature continues to manifest and leads to racial disparities in access to services, opportunities, experiences, and systems. And we want to make sure we think about how power is a key component of institutional racism. So power being attained through financial or social wealth, representation in the government, representation in the media, access to information. Many social potential is what I want to call them, determinants, because I think for those of us that do research or in academic settings, they talk about social determinants of health and basically say like these factors determine, your outcome in life. And I want to broaden that to say potential, right? Like these are social potential determinants that may impact suicide risk or that are perpetuated by institutional racism. And these potentially determinant factors include education or housing, lack of education or lack of stable housing, lack of employment, limited access to medical care, environmental health being a huge one. And we can talk specifically to that experience within Michiana, environmental health being a concern, or the involvement with the justice system, right? So that's kind of me going over just generally structural and institutional racism. Other societal level risk factors include intergenerational and historical trauma, mass incarceration, the school to prison pipeline. So children, young Black children, presenting with what we would call externalizing behaviors. For those of you that are on the ground, it's the kids that are the ones that are getting the most in trouble in the classroom, the ones that are getting into fights, those sorts of things. And instead of asking the child what's going on or what's happened to you, we often, incorrectly say, what's wrong with you? And instead of offering them mental health services to regulate their emotions, to figure out what is it that's making it difficult for you to focus in the classroom? Or what is it that's making it difficult for you to sit in your seat? Instead of having that conversation, they end up going to detention, which easily then is that pipeline to juvenile detention, which is in the pipeline to prison or later incarceration. Other societal factors to consider risk-wise is stigma in the intersection of race and mental health. So I think generally speaking, we know that outside of Black identity specific, we know that mental health is stigmatized. I think that's changing a lot with social media, especially in the younger generation. But historically, mental health has been a really stigmatized topic. Now, if you combine that or if you intersect that with Black identity, that increases that stigma, right? So you have two different pieces that can kind of perpetuate the stigma for Black kids and families accessing mental health services from a societal perspective. And then we have poverty, which I think fits in with all the other already mentioned factors. Now, we know that specifically racism and discrimination, and racism being more interpersonal racism and discrimination, that has negative effects on Black kids specifically. So perceived discrimination increases suicidal ideation. There were a few different studies that were conducted in 2017 and then a newer one in 2020 that specifically looked at the way that adolescents perceive discrimination and how that jeopardizes or negatively impacts their psychological health. And we know that Black adolescents average over almost 5 racial discrimination experiences per day. So if you imagine almost, when we talk about microaggressions, those small cuts over time, 5 days in a row, every day of the week that you're in school or you're in your workplace, that has significant ramifications for your mental health. And then I didn't even have an opportunity to really include a lot of our conversation around the media and social media specifically, and the exposure to traumatic videos online associated, and that's been associated with depression and other like post-traumatic stress symptoms among Black and Latinx or Latina adolescents. So we've talked a little bit about the societal level factors. Let's talk about the community level factors, one being community violence. So the community, we can describe a community in like a geographical way, like this street, this neighborhood. But we also can think about it as a virtual community or wherever we kind of share identity together, such as a place of worship or a school community. So when we think about community violence, there was a psychologist, Lambert, who did a lot of work in community violence and has mostly looked at more so community violence and its impact on health, physical health, and mental health. But he did do a little bit of work on suicide, which I found to be really interesting, given a lot of my work in community violence. And the intersection of those two things. So what Lambert found was that community violence exposure and later suicidal ideation was a concern for both Black males and females, Black boys and girls. For girls, community violence exposure in grade 6 was associated with depression symptoms in grade 7, which in terms was positively associated with suicidal ideation in grade 8. For males, community violence exposure in grade 6 was associated with increases in aggressive behaviors in grade 7, which in turn were associated with suicidal attempts in grade 8. So you see this direct association between community violence exposure and later suicidal ideation. Other important community level risk factors include exposure to police violence. When we think about a community space, we think about what services are being offered there. So you also want to consider barriers to accessing quality care, whether that's healthcare, mental health care, or physical health care, and how the fear or mistrust is prevalent among Black communities, as well as the concern about the quality of care. Another consideration for community level risk factors is school disengagement. We know that kids who disengage from school, they are at significantly higher risk for a lot of concerns, and suicide, unfortunately, is one of them. Now, relationship level factors. We want to think about interpersonal, so between people, between, your home, or your kind of insular system, how do those increase your risk for suicide? So you think about social isolation or discord, meaning like fights between family members, a family history of mental health concerns. So we'll talk about individual factors such as a child themselves having a mental health concern, but we want to think about also relationship level factors of having a parent or a caregiver who has a mental health history of depression or anxiety or ADHD or substance use, right? That we know also increases a child's risk for suicide later in life. And then also think about interpersonal racism, such as colorism or discrimination against LGBTQ plus Black youth. And that's where that intersection comes up again, where it's one thing to be a Black youth and to be living in a racist society or to be having to manage, racial related stress or trauma. It's another thing to be a Black youth who also identifies as LGBTQ plus, right? So you not only have one kind of stressor that you're trying to manage and overcome, but you have another one that can also increase your risk for suicide. We also know that family violence, domestic violence, intimate partner violence, parental violence, that can also increase someone's risk for suicide, as well as the death or loss of a loved one. So individual risk factors that I've spoken to earlier, mental health history is obviously a risk factor for anyone, regardless of their racial or ethnic background. But what's unique for Black youth is their presentation and their endorsement. So what they say about their symptoms of a mental health concern is likely different than others, different than their peers. So we first have to understand how those differences present. So how might a Black adolescent boy talk about depression without ever saying the word sad? How might a Black adolescent girl or a young Black girl talk about anxiety without ever using the word that I feel nervous or I feel anxious, and instead is just leaving the classroom or is shutting themselves in their room, right? The presentation of mental health concerns is different. So it calls us to have to both assess for mental health concerns differently among different groups, specifically Black kids and families, but then also how do we treat it? But generally, we want to think about how mental health history for Black kids, it can be an individual level risk factor. Another risk factor for suicide that commonly affects Black youth is exposure to trauma. So obviously, Black youth are not all the same. They do not have the exact same experiences. However, we do know that research says that Black children have a disproportionate exposure to adverse childhood experiences and trauma. I've gone through a few of those from like a community level or a societal level. But we want to highlight how exposure to those experiences can also increase someone's risk for suicidal ideation or a suicide attempt. And that's something that I am really committed to understanding, given all of my experience working with kids that have been exposed to trauma and knowing that they're now at an increased risk for suicide later if the trauma symptoms aren't addressed and they continue to present with these sorts of concerns. I think the fourth point that I have here, it's interesting because a lot of people will talk about almost as if being Black or being LGBTQ plus are identifying as lesbian, gay, or trans, as if those are risk factors. And I want to be really clear that those identities alone are not the risk factor. Those are characteristics and important parts of a person and their identity. The risk factor is being those things and living and being a part of racist, homophobic, transphobic societies, right? So we want to make sure that we don't pathologize or put the blame on someone based on their identity, but rather the system that they're a part of, because I think that then challenges how we intervene and how we talk about the problems, how we maybe prevent suicide, or how we provide treatment or any kind of mental health care service. Now, bullying is interesting because adolescents, the research suggests that adolescents who've been bullied are more likely to report experiencing suicidal thoughts, or have a suicide attempt, but it's unclear about the direct relationship because sometimes it can be like, we know plenty of kids who have been exposed to bullying or victimization and don't have thoughts of death or hurting themselves. And then there are significant amounts who do, right? So that one is unclear, and we want to continue to explore that. Here I just listed another piece of data that's helpful to kind of visualize how Black LGBTQ plus youth face compounding discrimination due to their intersecting minoritized identities. So discrimination is a common experience for Black LGBTQ plus youth. And you'll see here that a good portion of those who are discriminated against due to their sexual orientation attempt suicide, versus those who are discriminated against due to their gender identity, and then those who are physically threatened or harmed. So it seems as though the percentage of those who are physically threatened or harmed due to their sexual orientation are likely, or there's an increased risk for attempting suicide specifically. So I want to also highlight how Indiana's youth risk factors can be a part of that. And talk about how, first, the poverty rate in Indiana has increased over the past couple of years. There are significant poverty disparities across racial and ethnic backgrounds. All Indiana youth of color experiencing poverty are at a higher rate than the state average. So Black children make up about 10% of the youth ages 5 to 17, but are double the percentage for those that experience poverty. So about 20% of our youth that experience poverty are Black. And there are other, important things that we want to consider when it comes to Indiana specifically, that when you click on this link, when you have the PowerPoint, that it'll go to a data page where you can learn more about what are the specific risk factors in Indiana. They're very similar to national risk factors for Black youth, but something we want to consider. For example, the thing I mentioned earlier about LGBTQ plus youth in Indiana being at greater risk for suicide and having thoughts and reporting to have thoughts of suicide. So again, we know some general protective factors. So we want to talk about those, right? We just went through a litany or a whole list of risk factors that are impacting Black youth. But let's think about what are the protective things? What are things that we know that are going to help Black kids thrive in the face of their risk for suicide? So here I've sort of highlighted what we know about protective factors. And there are even fewer studies that have looked at protective factors in Black youth and children and adolescents that buffer against suicidal thoughts and attempts. And one helpful way to describe the protective factors is just 5 areas. 1, strong family or familial support relationships. 2, religious and spiritual engagement. 3, community or social support. 4 is personal factors, such as having positive self-esteem, being able to regulate your emotions, and having a strong academic performance. And then 5 is factors such as stable housing or parents that have stable income or are stably employed. Those are going to be the protective factors that we know can buffer for children, Black children specifically, against suicide. So when we think about the societal level protective factors, one being we think about the reduced access to lethal means of of suicide among those at most risk. So what that means is if we know young Black boys are more likely to have access to guns at an early age due to the prevalence of community violence and gun violence, we need to consider, how does community violence increase their risk for suicide, and how do we decrease community violence and in turn potentially decrease suicide? So more strict firearm laws would be a way to address that, and ensuring that we get guns out of the hands of our young Black kids. Just policies and laws within schools and the community at large are societal protective factors. Having health and mental health care funding and having resources for kids and families, and having improved equitable research for the well-being of Black communities. So something to consider there is the fact that you'll see as I'm talking about the protective factors, there are things that I'm sure you and I can think of that we would think that would be something helpful for a Black kid who might be at risk for suicide. But unfortunately, we do not have a significant amount of data to support what you or I might think about that. And so that's an important additional protective factor that we can think through, is how do our researchers, our clinicians, people on the ground like you and myself, or you and I, that we can think through, how do we better research and understand the protective factors and then implement them in schools, in communities, in churches, sort of thing. So community protective level factors, availability of those healthcare systems within your neighborhood, availability of culturally competent health and mental health care, a sense of connection to your community or to your school or other community-based safe spaces like the Boys and Girls Club, like other organizations or programs that are out there that promote childhood flourishing or well-being. Neighborhood collective efficacy. One of our Notre Dame students shared a new concept with me this past year, and that's neighborhood collective efficacy, which is sort of like the glue that binds neighborhoods together. It helps explain why some communities are able to fight crime and other communities aren't able to do that so well. It also speaks to how, years and years ago, the way that my mom describes growing up is that everyone on in your street knew who you were, and they knew who your mom was. And if you weren't without your mom, that woman who was there, that was your mom. She was going to protect you and make sure that you were safe, make sure you kept out of trouble. And she was going to tell your mom what you did or didn't do. So that's a part of the neighborhood collective efficacy. And we know that that's a protective factor for Black youth. And unfortunately, research is showing that neighborhood collective efficacy is decreasing in Black neighborhoods and communities. So thinking through, how do we increase that to increase people's, or children specifically, their protective factor against suicide? So some relationship level protective factors. So thinking about that you and I protective factor. So perceived social support. And this is important because it's not so much the amount of friends you have, right? So when we're thinking about who is or isn't at risk for suicide, we don't want to think about, oh, you need to make sure you have a lot of friends. We need to make sure you perceive, or you see yourself having someone that you can trust and go to. That's that perceived level of social support. Religious or spiritual participation, use of social support or kinship, right? I think it's one thing to say that, oh, I have a friend. It's another thing to say, like, I call them, I text them, I spend time with them. I know that I can depend on them. That's the important relationship protective factor. A sense of connectedness, especially for LGBTQ plus youth, and them having some sort of space that they feel affirmed in their identity as LGBTQ plus. And then stable housing, income, family employment. We talked about those things in the context of parenting or whoever the caring adult in the house is. What many of these factors have in common is they promote a sense of connection and mattering, like being acknowledged by others, having a sense that others are concerned about your well-being. A child or adolescent, they want to know that people care about me and my well-being and my safety. I meant to mention this earlier about community violence and how I see it kind of intersecting with suicide, but a lot of times when I would assess for suicide among pediatric patients coming into the ER for a gunshot wound, I would say 99% of the time they are going to deny. If I ask them, have you had a thought about hurting yourself, or have you wished that you were dead, or have you had suicidal ideation? They would say no, right? If I were to ask them, and I would put it in the context of their experience, last night when you went out and you knew, so and so had a problem with you and you pulled your gun or they pulled their gun, did you feel like your life mattered? And that often elicits a much different response. Most often, kids will respond, especially young Black males, Black adolescents will respond, I feel like my life doesn't matter. So I don't really care what happens to me. And that to me is really unique to Black youth specifically. And I think that anecdotal data or qualitative data has helped me to understand, how do I ask the question about suicide for Black youth differently than another kid, than a peer that they might have. Because I don't think they're going to answer it by saying, yes, I've had thoughts of death, but they are going to answer it by saying, I don't think my life matters, or I don't think anyone cares about my life, right? So individual level factors, if we know that a risk factor is a history of mental health concerns, then an individual protective factor is going to be mental health care access or service or engagement. If we know that risk factors include inability to cope with things or having difficulty problem solving, individual level protective factors have been found to be effective coping, problem solving, emotion identification, being able to identify your emotion and regulate that emotion, and having a strong sense of cultural identity, having a positive self-esteem, and having strong academic participation. So the question that I kind of want to pose to all of us is, at what level can you or your organization promote a protective factor? So we kind of went through all the different tiers, whether it's from a societal perspective or a community level perspective, or that interpersonal relationship perspective. How can we, each of us individually, as well as a collective from the organizations or programs you're part of, promote a protective factor? Now, I'm mindful of our time, so I'm going to spend a little bit talking about our suicide risk and screening, suicide risk screening and assessment tools that are out there. I do want to start off by saying that according to the U.S. Preventative Service Task Force, they were trying to study whether universal screening, so screening everyone for suicide risk, was beneficial or not. And unfortunately, their recommendation was that it's not. It's not beneficial right now to screen every single person, every single child for suicide. So I say that just in mind of like, don't take these measures and say, okay, we need to give them to everyone no matter what, right? Of course, those people that are at risk, that we know are at risk, it might make sense to do that. And here are a list of them that I provided. And as I mentioned, I provided links to most of them, to either like learning how to administer them, talks about who can administer them. Because again, a lot of these are for more like clinical settings. A lot of them are used in primary care settings and things like that. But this list comes from a recent study that looked at where these measures were used in other studies and whether they were given to racial and ethnic minoritized participants. Because again, we want to make sure that if we're going to screen for these concerns, that we do it in a way that is specific to the child that we're screening, right? So these are the ones that have been found to be most useful among all of the different screening measures out there to screen for suicide among Black kids and adolescents. So suicide risk prevention and intervention. I love this quote by Dr. Alfie Berlin-Noble. She says, why does our field persist in promoting mental health interventions and calling them evidence-based if there is little to no evidence for them for people of color? Evidence informed, I get, But evidence-based semantically sounds definitive. How can it be definitive if we only know evidence for one group of people? And if you do training with me at my training clinic, I talk about this a lot because we do have a big push in our field to talk about evidence-based treatment. And that's a fancy way of saying we've done research to say whether we think that this treatment is going to work or not. The issue with that is a lot of times when we say we've done research, that research was on a very specific group of people or group of kids from a very specific demographic or background. So the unfortunate thing is that we don't know a lot of prevention or intervention strategies for suicide risk, specifically among Black youth. We know generally that there are some helpful strategies, but I've listed here from like least to greatest, or greatest to least, which ones are most effective at addressing suicide risk among Black youth, multi-systemic therapy being considered like the top well-established intervention for Black youth. And again, you can click on each of those, and I'm happy to talk more about them one-on-one. I'm trained in at least half of them. And so I kind of left a question of like, what way can you or your organization implement a screening, intervention, or prevention opportunity? What does that look like for where you're located? And the final thing I wanted to discuss is like prevention-wise, what does it look like for the work that I'm doing? Right now, I'm working to develop a culturally tailored community-based suicide prevention program for Black 9 to 12-year-olds and their parents, and I'm partnering with the Boys and Girls Club of St. Joe. So after I've talked about all of these things, you'll notice at the very, very beginning, my big concern was that 12 and under age range that are dying by suicide or are engaging in self-harm. And my thought is, if we're able to look at all of the protective factors that we know protect kids against suicide or buffer against suicide, how do we elevate those protective factors in a community setting to prevent later suicidal behavior when they're, 16, 17, 18 years old? And how do we do it in a way that also prevents community violence? So I'm thinking of this from a community-based participatory research perspective. And that's just a fancy way of saying I'm thinking about how do we develop this for and with the people that I want to do it with. So for Black kids, with Black kids and families. So we have a few different groups going on that we'll start. We have our expert advisory board. We have an adult community advisory board, which includes people like yourselves to be able to be a part of this and offer feedback on what do you think should be included in a prevention program for Black kids and families that we want to specifically target or decrease their suicidal risk. And then we want to have a youth community advisory board as well, where we invite youth from the community who have lived experiences and can say, these are the things that help prevent me from going down that path, or they help prevent me from engaging in self-harm. And from there, developing a treatment, as opposed to me being in my office thinking of my own or using the very little research we have. We need to work together to come up with solutions together. So that's the connect to protect kind of framework. So I know that I went a little bit over. I wanted to leave us 10 minutes. We have 6 minutes to engage in some Q&A. So I'll hand it over to Jan if there are any questions or thoughts that people have in our last few minutes together.
Yes, Taylor, we have a few questions. The first one, it sounds like we need to ask the question around suicide differently when it comes to engaging with Black youth. Do you think this is a factor that has impacted the data around low suicidal ideation in Black youth?
Sure. Yes, definitely. I think that we've been asking the question inaccurately or ineffectively, and that we likely, because it wasn't a concern, we likely haven't been gathering the data correctly either. Yeah, that's a good point. So maybe it's not so much that it's not just that the trends are significantly changing all of a sudden, but rather all along, we haven't done a good job of assessing for risk and capturing those that might be falling through the cracks of like deaths in the United States, how many of those are related to suicide and not, a gunshot wound or things like that. Yeah.
Okay, great. Second question, how do you think the schools and community can partner together to help address these concerns? And that was when you were talking about the risk factors, I think.
Yeah. Yeah. I mean, I think there are a lot of ways that the schools, what was it? Schools and the just community?
The schools and community can partner together to address these concerns.
Yes. I think that as like a therapist, as a child psychologist, I think schools are like the fertile ground for mental health interventions. And like prevention, mental health intervention and prevention, right? Children start out in school from very, very young, and they spend 18, however long years of their lives in school settings. So I think there are lots of ways that schools and communities can work together. I'm thinking of, developing prevention programs that can be offered after school or before school or during a lunch period, where you work on emotion regulation, which is just like a way to manage your emotions better. You work on problem solving skills. You work on cultural identification and feeling a sense of empowerment about being a young Black girl. Those sorts of things can be done in a school setting that might be much more difficult to bring your child to my clinic or something like that, or to my office.
Okay. And then finally, how would you measure the stigma and taboo that attribute to Black youth suicide?
How would you measure it? So there
Yeah.
are measures out there, like stigma measures that you could give like children to fill out and parents to fill out their adult and child measures. So if that person is really interested, email me and we can find some measures together that specifically look at that.
Okay. Thank you so much, Dr. Nicoletti, for sharing today.
Thank
We
you.
want to remind everyone that this webinar has been recorded and it will be uploaded in probably about a week. We want to ask you to please do the evaluation that should be dropped in the chat box in just a few minutes. And we will be emailing. There was a question about the PowerPoint presentation. We will be emailing the PowerPoint presentation, the evaluation, and I think Dr. Taylor is going to have a list of resources, maybe.
Yep.
Yeah. So we're going to email all that out. Give us about a week to get that information to you. Also included, you see her email. If you did not get a chance to write it down, it will be in the PowerPoint, and you can email her any additional questions. We want to thank you all again for joining us, and thank you, Dr. Nicoletti, for sharing your wisdom with us on today.
Thank you. Oh, you're on mute.
You're mute.
I just wanted to say you did a great job, and thank you for being here today.
Of course, of course. Thank you so much.
128 came so fast. So I'm sorry, I didn't mean to cut you. It came so fast.
I know. No, that's totally fine. It always happens. You always feel like you're like trying to get through everything. That's why I try to link as much stuff as I can in my slides so that people can go back and look at things. And hopefully they reach out to me. I feel like unlike like national presentations, this one is local, so we could get coffee and talk about these concerns, So that's what I really enjoy about opportunities like this, is what comes after it.
Yeah. Well, you had quite a few. Thank you. Wonderful job. So I'm sure.
Great. All righty. Well, take care and stay safe, stay warm.
Yes, you too.
I'll see you around.
All right. Thank you. Bye-bye.
Thank you. Bye-bye.